I'm here today to share and connect with Dr. Elliott of BC Diabetes about how we can improve health outcomes for residents of British Columbia.
BC Diabetes is a full-service diabetes centre in new premises at 210 West Broadway. Our mission is to optimise care and to improve outcomes for all 350,000 British Columbians living with diabetes. It requires lifelong therapy. Lifelong therapy requires coping skills, it requires finances, and it requires planning and dedication. The biggest thing in my practice in November 2016 is finding a way to get almost 70% of my patients onto a drug in the SGLT2 inhibitor class. This is a class of medication that's been around 2 years and which is by far the most effective oral medication tablet for lowering blood sugar. It costs around $3 a day and is not covered by BC Pharmacare. It's covered by every other province in Canada. The fact that it's not covered is astounding because not only is it the single most effective drug at lowering sugar, it also lowers weight, and most importantly of all, in high-risk patients with diabetes, it reduces mortality by 32%. If I were able to project what it would mean if all 50,000 British Columbians at high risk were to take that drug today, it would mean saving 600 lives per year. Faced with this knowledge, BC Pharmacare still chooses not to cover these drugs. Well, the most obvious one is that it's much harder to control the blood sugar without the drug, so it's just a very effective drug. The second thing is that people who don't have the drug tend to gain weight. 80% of people with type 2 diabetes are overweight to start. Standard medications cause weight gain. If you have access to this drug, not only do you not gain weight, you actually lose weight. The second aspect is that it delays the need to take injections of insulin. Patients don't want to go on to insulin until they absolutely have to, so it may delay starting insulin by a year or two. And the final one, the biggest one for me as the medical director of BC Diabetes, is that it reduces risk. Diabetes is a disease that carries a much higher than usual risk of heart attack, stroke, and premature death. Patients taking this drug have a dramatic reduction in that risk, and that's very important. It gives them hope, it gives them optimism, it helps them comply and adhere to complicated treatment regimes. It places major restrictions on very effective therapies and devices that would benefit many of my patients, so I'd like to see them review the whole policy. But the most important one, the biggest one they could do right now is to cover the SGLT2 inhibitor class of drug. About $3 a day for a lot of patients who would derive tremendous benefit.